Now we will reach to the last presentation by Dr. Hajer Almudaiheem. She is advisor to the Assistant Deputy Minister of Therapeutic Supportive Service in the Ministry of Health. Dr. Hajer, she is Director of Drug Policy and Regulation Division. She was appointed as the head of National Drug Information Center at the Minister of Health in 2015 and established more than 50 centers across the kingdom. Dr. Hajer is responsible for MOH formulary management and was recently appointed as a drug policy and regulation manager. She is a board member of a pharmacy professional society under the Saudi Commission for a Health Society, and also she is a board member of the Saudi Clinical Pharmacy Society. Dr. Hajer will talk about the IPF registry.
يعطيك العافية دكتور عبد الله. And I know we are coming to the end, so I will be very short and precise. And I'm going to add really an important messages that I've been hearing throughout the day. So first of all, this is my conflict of interest, so I have no real or potential conflict of interest related to the subject matter of this presentation. So I usually and always like to start on the Vision 2030 when it comes to Saudi Arabia. So we know that it is mainly 3 pillars: thriving economy, ambitious nations, and vibrant society. And this is where we were talking about the increased life expectancy of Saudis to be more than 80 years old. And when it comes to really the transformation in healthcare, again, we have 3 strategic objectives: ease access to healthcare services, improve the quality and efficiency, promote prevention against healthcare or health risks. And this is what our KPIs and objectives when it comes to healthcare. Again, why we are implementing these real-world, let's say, the value-based healthcare when it comes to certain management. And I've been hearing today a lot about patient care, patient follow-up, patient outcomes, improve life expectancy, improve patients' health outcomes. And this is what everyone I've been listening throughout the presentations when it comes to patients' care. And we know that we are now considered in the Ministry of Health leading an initiative when it comes to rare disease, and IPF is being designed or defined as rare disease somehow based on the numbers of patients. And we've listened a lot on the delayed of diagnosis, number of centers that have been managing IPF, and the late presentations of these patients. So these are all pillars that we need to focus when it comes to the management of such diseases. And we know that these medications are coming, and the pipeline of these medications are coming, and they're not coming cheap. They are very high in price tag, so we need to make sure that we have the right access of these medications, because we all suffer from the budget constraints, and it's not only IPF that we are dealing with. And then, as I mentioned, it is one of the KPIs is to monitor and see certain outcomes of patients, so requirement of health outcomes, and then the utilization, as we are in the digital era, so we need to really utilize these digital data and keep it to our utilization. So I will be focused on what we have done when it comes to the managed entry agreements or the value-based healthcare when it comes to certain medications that has been introduced. And this is what we've done with the BI when we have discussed their medication, the management of IPF. So we have 3 components: clinical, financial, and services, and this been all ticked by BI. When it comes to clinical, we have assigned on certain clinical outcome to look at and follow up the patients within at least a year, 12 months, is the percentage of FVC reduction. And then when it comes to financial, so either they have provided with number of FOCs as initiation or as a discount directly through NIPCO within their prices, and services with the development of the registry and certain activities within the registry itself. And we have as well developed the first and only in the region when it comes to the policy of managed entry agreements. So I highlighted different responsibilities and stakeholders who are involved in such managements. Alhamdulillah, we have قبل 5 سنوات احنا ما كنا في هذه البيكتشر، السعودية ما كانت هنا. Lastly, after 5 years, we have now in the 5th place after Australia in concluding or implementing managed entry agreements or value-based healthcare in the country. We all know and understand, and this is what we are seeing currently in our committee when we review these cases of IPF. So we make sure that the patient is being looked at or managed by consultants. We make sure that different diagnoses, different follow-ups and labs and imaging is being there. So, and the treating physician is as well being involved in the discussion when it comes to the management of these cases. So all of this is being ticked as well when we are reviewing these cases, especially when it comes to IPF. This is just a screenshot. I just wanted you to understand how we do that. So we do have a medical lead assigned by His Excellency in different disease areas. And then we created our scientific committee from different sectors and different regions in order to be close to multiple regions, not only Riyadh, but we need to make sure that we are close to multiple regions. We need to listen to them, know what is missing. So this is very important. And then we meet in order to have a setup of the what do we need to look at in building these registries, what data that we need to look at. And then we go in registry deployment on a certain, let's say, piloting in certain centers, and then we expand. And we make sure on the registry governance and the quality check of these data in order to make sure that these data is really representative, and this is what the actual data of those patients, because we are reflecting on these outcomes based on these baselines. And then hopefully we publish each year after different registries data reports that we are generating, and inshallah you will be seeing these in the coming next year, inshallah, or late this year. I will not look deeply on that. I just want you to, sorry. This is just the timeline of starting IPF in the Ministry of Health. When did we evaluate the management of IPF? When did we include nintedanib into the formulary? And when we created the steering committee and we kick off the first meeting and introducing the first patient into the registry and follow up those patients. And IPF or pulmonary, that it is a very unique committees because we involve the direct patient consultants or the patient treating physician into the committee, discussing the imaging and discussing CTs, in how is the patient presenting and what is the, let's say, the needed outcome, just to make sure that we are understanding what are we looking out for those patients' outcome in managing IPF. So this is where are we at. So تقريبا now we've reached to 40 cases, and we are doing this every week or every 2 weeks, making sure that all data and all required information is there before the committee is meeting and discussing these cases. By the end, I just want to highlight multiple key messages that has been talked today is the collaboration between different, let's say, hospitals, institutions, mind when it comes to the management of IPF. The early diagnosis is very important and it's crucial for patient to be, let's say, managed and have a better outcome. As we said that I think it's 3 to 5 years life expectancy after patients been diagnosed with this disease. Why? Because again, the late diagnosis of this disease to the patient, to the healthcare. Third thing is, I think we've talked about the guidelines and what's the adherence of the guidelines. I'm not sure if there is any local guidelines, but I've been listening to multiple guidelines, and this is what we are following up. And lastly, as one task that we are going to do, inshallah, after this meeting is we're going to have or publish the IPF burden of disease in Saudi Arabia, and they are all welcome to be a co-author in this project. By this, I end my talk. Thank you very much.